Well, naturopathic medicine is a system of primary care medicine. Basically, we are trained very similarly to allopathic physicians. We have a 4-year undergraduate period of study and then a 4-year period of naturopathic medicine intense study. There are 4 medical schools in the US that currently train and accredit. They're accredited schools, so they train doctors in naturopathic medicine. And what it is really a few things. The philosophical difference is what separates it from allopathic medicine. Mm-hmm. So we're trained similarly and actually we spend twice the amount of hours in anatomy and physiology. So naturopathic doctors really understand how the body is working innately on its own. We have an incredible, amazing system of biology and physiology that is meant to repair itself and detect when there's a foreign invader and take care of itself. And so naturopathic education spends a lot of time to understand how that works. So whereas in the allopathic model, there's half of the emphasis is on that and half of the emphasis is on using pharmaceutical interventions to cover up some of the symptoms. And so that's the antithesis of what naturopathic medicine does. Naturopathic medicine wants to get to the underlying root cause of the symptoms. So an analogy of this would be if your car check engine light goes on, and the allopathic model would be to find a way to shut that light off. So no more problem, right? However, the naturopathic model, we know that light went on for a reason, and we're going to seek to find the underlying cause of why that went on and basically correct that. Put some gas in the tank, put some oil in the gears, So we also, in addition to underlying that root cause and finding that, treating the whole person as a whole connected system. We do not compartmentalize folks, and we're often looking at how the systems are connected, a major connection between the gut, the immune system, and our brain. For instance, that's a lot of where I focus my practice, because often folks that have things going on in the digestive area will have immune system imbalances and often have neurological type and mental emotional type concerns as well. So treating the person as a whole system. And then emphasis is also on prevention, trying to prevent illness, because it's much easier to prevent things as opposed to actually treating them once they've gotten, especially if it's a long established chronic illness. So emphasis on prevention and individualized treatment. Really, there are no cookie cutter type protocols. So we really don't treat this. So if a person comes to me with eczema on their skin, there may be 7 different ways to treat that. And I'll talk a little bit more later on about how I individualize my treatment in a visit with folks. But naturopathic medicine is kind of like being a medical detective. And we're trying to find out all the nuances about what goes on in this person's life. And that person lives inside of the environment and has interactions with that. And so it's not only, we're looking at many factors that result in the person's health and contribute to the health, including their diet, their interpersonal relationships, their genetics. And the genetics are only about 30% of how we express actually what our health is. So just because we may have a genetic tendency, there's 70% chance of whether that gene gets turned on or off. And that's really where naturopathic doctors work. And those genes are controlled by things in our environment. So it's empowering to know that we're not doomed with some type of, lingering disease coming down the line. We can modify it. And the brain is neuroplastic, so we can change things even if there was damage. So naturopathic medicine is about repair, empowerment, prevention, and connection.